When dealing with infertility, there's often a lack of emphasis on the incredible importance of lifestyle, dietary behaviors, and their significant impact on reproductive health. And I love highlighting the importance of these changes and modifications, specifically because they're incredibly accessible. 2, they can help with overall health and well-being, not just fertility. And 3, in many cases, implementing some of these changes can be incredibly cost-effective. And now we're seeing more scientific evidence on demonstrating the importance of implementing some of these changes and potentially having significant impacts, again, not on just overall well-being, but specifically fertility treatment outcomes. Physical activity is absolutely no exception to all the things that we discuss on their impact to reproductive health. And a newly published study that looked at over 6 clinical trials and their impact on sperm health and reproductive outcomes found some very, very valuable correlations. Number 1, physical activity, again, has been now looked at not just for fertility, but for so many other health benefits. We see it can have a significant role in supporting mental health and well-being. It can support cardiometabolic health. And now we're also seeing a potential role for reproductive health and fertility. Mainly, engaging in increased physical activity has now been observed to be associated with an increase in pretty much all the sperm parameters across the board. The more important ones: increase in sperm concentration, an increase in total sperm motility, an increase in sperm morphology as well. And my favorite part of the newer findings from this study was that not only did it translate to an observed increase in these sperm parameters, but there was actually an observed increase in clinical pregnancy rates and live birth rates, which is the ultimate goal of any fertility treatment to begin with. So how does this all happen? We all know physical activity can be beneficial, but why specifically for reproductive health? And why does increasing physical activity for biological males actually translate potentially to an increase in live birth rates for couples dealing with infertility? Number 1, increasing physical activity seems to be associated with an increase in the production of antioxidant enzymes and a reduction in oxidative stress in the reproductive organs, and an increased antioxidant capacity in mitochondrial cells, the powerhouse of cells that produce ATP. Number 2, there seems to be an impact on telomere length and reproductive aging. So we see individuals that engage in less physical activity tend to have shorter telomeres. This is a sign of increased cellular aging. Those that engage in more physical activity tend to have longer telomere lengths. And this is important because shorter telomere lengths are now strongly correlated with reduced sperm parameters like reduced motility. It also seems to counteract some of those important negative effects of a sedentary lifestyle. Increased adiposity and reduced physical activity can alter the ratio of estrogen to testosterone in the body. It can affect things like insulin resistance. It can negatively affect production of inhibin B, and it can alter the production of a very important protein in the blood called sex hormone binding globulin. And the changes in these metabolic and reproductive hormones and protein can negatively affect the activity of spermatogenic cells in the testes, the cells responsible for the production of sperm. And there may be an important role for cholesterol as well, which has now been implicated in having a potentially negative impact on reproductive health. Elevated levels of cholesterol have now been associated with reduced sperm parameters and are also linked with an increase in oxidative stress and pro-inflammatory mediators, both of which can negatively impact reproductive health. It's possible that the increase in physical activity may also be improving the sperm health, indirectly supporting fertility by actually affecting some of those cholesterol levels as well. Now, it's very important to highlight the main finding here. This is all observational and we can only establish correlation but not causation. That being said, because of the general high safety profile, including more physical activity and its potentially other vastly beneficial impacts on our overall well-being, it is something that should be strongly considered in your healthcare team to see if this should be utilized in a certain way to help support your reproductive health. And surely some forms of exercise seem to be better than others at supporting reproductive health and fertility. So it is very important to speak to your healthcare team about which forms of exercise would be most suitable for you depending on your health, pre-existing conditions, and diagnoses.